Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Nawaz Habib.
Hello, everybody. Welcome back to the Health Upgrade Podcast. This is Dr. Habib. I am here with JP. How are you, sir?
I'm doing great.
Wonderful. And we are joined by a very special guest, Amanda Archibald. This episode of the Health Upgrade Podcast is brought to you by Truvaga. Have you been looking for a simple way to feel calmer, think clearer, and sleep better? Imagine achieving this with just 2 minutes a day. I'm excited to introduce you to Truvaga, a handheld device that supports your nervous system through gentle vagus nerve stimulation. As a doctor specializing in functional health and wellness, I've seen firsthand how Truvaga has accelerated healing in my clients. I've used this device to help people with a range of issues, from sleep disturbances and heart palpitations to digestive dysfunction, nervous system imbalances, and mental wellness concerns. The results have honestly been remarkable. Truvaga is designed to catalyze and accelerate the shift in your body from fight or flight to rest, digest, and recover mode, helping you manage stress, maintain mental clarity, and unwind more easily. It's not just theory. I've witnessed its positive impact on real people facing real health challenges. The best part? Truvaga fits seamlessly into your routine. No need to carve out hours for wellness. Just 2 minutes a day can make a difference. It's a small investment of time for potentially significant benefits in how you feel and function each day. If you're curious to experience Truvaga for yourself, visit truvaga.com/upgrade. You can save $30 on your device by using the code UPGRADE30 at checkout. Remember, that's truvaga.com, truvaga.com/upgrade. It might just be the first step towards a calmer, clearer you, just as it has been for many of my clients. Nice to see you, Amanda.
I'm honored. Truly, I'm honored.
We're excited to be here with you because we're going to start talking a little bit about the genetics of vagus nerve function and dysfunction. And we want to get into understanding the pathways that are necessary, the genetic pathways, the specific genes that are necessary to enable the vagus nerve to do its job. And so we're going to dig into that with you as we go. But before we dig into that specific science, I'd love to hear a little bit about you and your story, how you got into nutrition first and then genetics after, and how this has become your passion.
Thank you. I'm asked that question all the time, and it's an important one. And I'm going to keep it short, but I will say I grew up in Europe, which is really, really important to say because the table in Europe and food is a critical part of our lives. It's where, people come together at different parts of the day and they honor each other. So it's as much about understanding the source of food and what food does and who produced it and what season we're in, as it is about the connectivity piece. And as humans, we're social animals, regardless of what regardless of the literature, we're human animals. And our genes love to be hugged too. So I'm a European first, and I've came to the United States nearly 40 years ago. It drove me to look around when I came to the United States and say, what is different here? That pushed me into nutrition science. Got a degree in nutrition science and dietetics, became a dietitian and realized there was a huge part missing here. Number one, the true biochemistry was not taught in a way that was applicable. And I'm a geek like you two. I'm an absolute geek. I was the one who loved the biochemistry. I loved the organic chemistry. I figured we weren't being taught it correctly. But the big part is we were not also taught the why behind how the biochemistry works in the body through nutrients and through ingredients. So long story short, I diddled around in my field for quite a long time, had a great career. To come back to, I was working in South Africa in 2013, met a couple of great scientists. They said, the way you think fits with nutrigenetics and nutrigenomics, come on over. And I never looked back. And that genomics, you cannot perform or work in my field in genomics or nutrigenetics or nutrigenomics without understanding nutritional biochemistry, which is how the body operates, right? It is the information, it's the language of the body. So that's my story, and I never looked back. And I caught the wave of genomics really when it was sort of starting to peak. And I can't imagine a life without it, the work I did without this manuscript for the body. So That's me.
I love that you named it that, the manuscript for the body. We've often talked about the genetic code being almost like the blueprint by which things work, but I like the manuscript as well. It's a great analogy. And this concept of nutrigenomics, I think it's a really important one for people to understand, maybe just the basics of it. There's numerous things here, and I want to make sure that we understand the definition of particular words, because genetics, genomics, nutrigenomics are all going to be intertwined. You mentioned nutrigenomics being where your focus is. Let's talk about the difference between genetics, genomics really briefly, and then get into this idea of nutrigenomics and your passion there.
Yeah, and I threw a lot of words out there, and you could see even clinicians mix them all up. And I was like, are you sure you're using the right word here? Because it's actually really, really important. So genomics really is the study of the human genome, or the genes that make up an organism, right? Like a jigsaw puzzle. And importantly, I saw a great analogy recently. Genetics may be the study, or is the study of single genes and their mutations and their impact on physiology, if you will. So they're like studying a piece of the jigsaw, whereas genomics is like the whole puzzle. And I think that's a great one for people to understand. In the space I'm in genomics, we're looking at gene variants that respond to lifestyle intervention. They respond to stress and emotional management. They respond to nutrients. They respond to movement. They respond to energetics, which is what makes the field powerful. So there's a big difference between genetics and genomics. Do you want me to carry on with nutrigenetics and nutrigenomics?
Sure, yeah. Let's dig into that. You mentioned that there are lifestyle factors that play a role in activating. So this is where the nutrition piece, what nutrients are coming in, specific nutrients that can activate specific genes to function in a particular way. So please.
Yeah, so nutrigenetics, I'm known for nutrigenomics, but I would say nutrigenetics is really the foundation of the field, because there we're looking at genes and their impact, their characteristics and personalities, or changes in their personalities, to make this accessible for your listeners, can influence whether a nutrient is absorbed, how it's utilized, whether it gets to its destination, which is really important for our topic today. So we can give so many different examples, which is why I was so excited to talk to you. So nutrigenetics, how the gene influence, how information is absorbed, metabolized, is a good way to look at it. And nutrigenomics is very powerful, because nutrigenomics is how we can write a recipe for the body that includes very specific nutrient cofactors, like maybe it's manganese, maybe it's cobalt, maybe let's think of folate for nitric oxide. We'll get into that. Whether it's nitrates, right? What we can fire at the body, as I say, what we can load onto an arrow to fire at the body to get those slacker genes to do their jobs, or to create a workaround. So we write in our heads these prescriptions, these equations that include information that the genes need to hear to perform their function. So we think of it as before the gene. How powerful is that? It's like taking the drug out and putting the nutrients in, because that's what the body hears. So that's nutrigenomics.
In many ways, we've talked a lot on the podcast about epigenetics, and how epigenetics really sits on top of the genome, on top of genetics, and allows cells to differentiate, to become a skin cell versus a liver cell, while carrying the same genetic code. And the genetic code is I like to think of it sort of as a static, sort of like a book. You can't really change. But how you implement the teachings of that book, how you utilize them, changes based on your life and your experiences, and what you take from that book and how you apply it is more important, frankly, for you than what was actually the words in the book.
Exactly.
And so I can imagine how nutrients and what you intake into your body, and I really liked, maybe it was just a slip of the tongue, but I really liked how you phrased it could be information you're intaking. It doesn't have to necessarily be a nutrient. It could be an experience 100%. That you take in. You're eating it, and how your genetic code responds to that, what's coming into you, is in part controlled by your epigenetics, as well as what the substrate is that those genes are working from. So the genetics is sort of the meat in the sandwich, and the bread on either side is the epigenetics and the nutrigenetics.
Yep. and that our bodies can respond to it. That is the most powerful thing, as I working with clinicians or talking to individuals I'm working with, your body has innate intelligence. My job is to help find that aperture, because once you hit it, the body can respond. We know that. And that's epigenetics, right? It's like your body can hear. Our job is to steer it. That's powerful.
So let's keep talking about some of the chemical mechanisms. We talk about with epigenetics, there's DNA methylation, there's histone modifications, there's small microRNAs and small interfering RNAs and other things. We've done a podcast or two going, I'd say, modestly deep into that. Talk to me about the biochemistry of how nutrients affect your genetic expression.
So should we get right to the topic then? Or why don't we use,
go for it.
let's talk about the vagus nerve, right? And what it needs, right? Because this is probably the best story. It's the best space to kind of unpack this code. So what we seem to go back, the reason I reached out to Dr. Habib is I happened to be sitting in New York at the Integrated Health Symposium this year. And I'd heard about you through my podcast partner, Sarah Amanda, last year. She said, "Oh my God, this guy, you have to listen to him." Because so we did. And then we all paraded back in and listened to you again this year. And the reason I got excited, there were three of us sitting like little birds on the fence, all of us in genomics. And you started talking about nitric oxide and acetylcholine. You had about 5 words out. I'm like, wait a minute here. We can help the vagus nerve. And you were talking about the sphincter, this brilliant, or sphincters in the body, and this brilliant interaction between nitric oxide and acetylcholine and how they're like seesaws. I'm like, but there's a genetic component here that I want to talk about, and then that's how I met you. And I said, we have to talk about this. So why don't we talk about that? But I wanted to kind of fire that in within the context of that presentation, Dr. Habib, because it was brilliant and it just fired off all these genes. So these gene conversations. So do we want to start with acetylcholine or nitric oxide? Or
let me give a quick just overview of this idea of how vagus nerve nitric oxide connection works really briefly, and then we can dig into each of the aspects. So just as a very brief overview, we're not going to get into the full presentation work that I did, but the idea of contractility of blood vessels, of sphincters, of smooth muscle within the body, in order for these muscles to become contracted and to essentially limit the flow of tools through a specific area, or food or blood through a specific area, requires acetylcholine. So acetylcholine comes in and it creates a contractile effect, and that's going to essentially compress. But nitric oxide has the opposite effect, where it creates dilation. It creates vasodilation in the blood vessels. It allows for dilation in the gut, in the intestinal tract, and it's essentially creating a dilating effect or an opening effect in the smooth muscle. And so we have this rhythmic contraction relaxation response with acetylcholine and nitric oxide going back and forth, essentially creating peristaltic motion in the gut, or vasoconstriction, vasodilation, allowing for blood pressure in the blood vessels to be enabled and for that to occur. So we need this back and forth constant flow between contraction relaxation to occur. And this was the whole idea behind this vagus nerve nitric oxide connection, because acetylcholine is going to be produced by vagus nerve stimulation, vagus nerve activation exercises. So in order for vagus nerve signals to be sent to their destination, acetylcholine needs to be able to be made and be signaled. And these are a couple probably of the genes that we'll get into, Amanda, specifically. So let's talk about the production of acetylcholine specifically. Acetylcholine esterase being the enzyme by which this occurs, but I imagine there's some steps before. I'll let you dig in. Let's go for that first.
So we're looking at two moieties, the acetyl moiety, a molecule, which is its own pathway, and then choline. And I have to say, when you started talking about this contractile, the sphincter piece, this seesaw of motions, we immediately, all three of us looked at each other and said, the gut. Like 80 or 90% of the clients we see have motility issues, or they have reflux issues. I'm like, who is thinking of correcting acetylcholine and nitric oxide? No one. It was just incredible to think about. So acetylcholine. So choline, of course, we can get it from our diet. And all three of us are old enough to know, to have gone through the years when eggs were demonized. And yet choline, right, is nature's gift. Like we all come from an egg somehow or other. And so there has to be a reason in nature why choline is in an egg. And yet what do you still see on healthy menu? A healthy omelet is an egg white. I'm like, that is wretched. Absolutely wretched. So choline, best sources, egg yolk. Yeah, we can get equivalents through sunflower seeds, lecithin, etc. But the body is brilliant. And it says, choline not only is integral to the production of the molecule phosphatidylcholine, which is integral to nerves, right? Transmission, but also the integrity of every single cell membrane. So that's number one. There's about 20 things I could think of here, but the body says it is so important. The other thing, and then we'll get into the genes, is that choline, to the point about epigenetics, is a methyl donor. That's why the body says if there's an issue with the methylation cycle, which is probably the most important cycle I can think of. To me, it's like the heartbeat of the body, of body's biochemistry. Choline is this detour that allows the body to produce this really, really important molecule. Therefore, the body has a couple of ways to synthesize choline. So we can get it from the diet. Not everybody gets it from their diet, right?
As a fun side note, 90% of American diets are deficient in choline intake.
100%. You can't even make that up. Probably because we did so much damage in the 80s and the 90s, let alone the recent, quote, egg crisis. Well, that aside, so there's a gene called phosphatidyl ethanolamine methyltransferase. We call it PEMT. Notice that I said methyltransferase. So this concept of methylation is really important for this gene to work. That cycle doesn't work. The body has a hard time making phosphatidylcholine. So what that gene does, it takes phosphatidyl ethanolamine, substrate, makes phosphatidylcholine. Bingo. Now we have phosphatidylcholine. The problem is when you work in clinical practice, you will see maybe up to 80% inefficiency in that gene. I don't see well people. Therefore, the occurrence in my population versus the general population is very high, that gene is inefficient. So that means the body's like, okay, now what am I going to do? So then we have to look to the diet, or we have to look to supplementation. It's probably the supplement I recommend the most, which is interesting because phosphatidylcholine, how does it show up in an inefficiency? Brain fog, classic, we'll get into that. Also very high levels of VLDL or some kind of congestion in the liver because phosphatidylcholine helps evacuate VLDL or cholesterol moieties from the liver. So if you back up then to midlife issues, what is it that activates PEMT in the body? Estrogen. So now we have a cluster, right? We have an issue. So our midlife, male and female, can often show up with changes in digestion, stress, poor sleep, they have non-alcoholic fatty liver disease. They can't sleep, like I said, and brain fog. I'm like, it all connects, right? And so it's a choline inefficiency, and all this would connect to the vagus nerve, right? And then they're stressed out of their mind because they're missing a chemical that the vagus nerve needs to do its job. So the brilliant thing is, so that's PEMT, very high rates of inefficiency. I don't know what the population level is, but it's very high. It's very common to see an inefficiency in that gene because the body's brilliant. It has another gene, and I can't remember the name, it's CHTC. Don't quote me on that, but it's another gene, which is a salvage pathway in the body. So if you can't kick into action PEMT, which happens a lot, you have this Kennedy pathway, which is an alternate pathway, which helps salvage what little choline you have because it's that important and makes it available. And that, when you have inefficiencies in both of those genes, that's where you may be supplementing with acetylcholine or something else because you've lost traction from two pathways. And I don't know how often you guys see that, but like these pathways are critical.
Do you have to supplement with choline, or do you supplement with phosphatidylcholine?
Me always phosphatidylcholine. I'm a phosphatidylcholine serine recommender. Like I said, I cannot believe how often I recommend that. And it could be my patient population, but it's manifesting in a lot of different ways. But I never thought about it from a gut perspective until you opened your mouth, Dr. Aviv. I'm like, oh my gosh, that was such a brilliant thought. But yes, phosphatidylcholine.
And when you see the estrogen withdrawal, or you see changes in dietary patterns, or you see just midlife crises, if you will, physiologically, not emotionally, although they're probably linked. But when you see that change, do you attribute that change to an epigenetic change? Do you see it as an epigenetic drift, a loss of that gene's functionality? Or do you see it as sort of the genetic problem has always been there? So it's actually written into the code as a mutation. There's an allele that's less effective, et cetera. Or is it something that changed as a result?
I think it's both. And first of all, I'd say it's polygenic. We would never just look at one gene. And also, can you bring up something here? We're looking at we're only just looking at choline here, but I'm now connecting that over to neurotransmitter pathways. So serotonin production and estrogen affects both pathways.
You need a methylation step to make serotonin from tryptophan and melatonin from
100%. And you need vitamin D, you need the BH4 molecule, which is really important for what we're talking about here with the nitric oxide. So we just talked about choline. So that's that one moiety, but there's another piece which is fascinating, which is the acetyl piece. So where does that come from? The body is brilliant too. Traditionally, the most powerful pathway is the glycolysis pathway. The glucose? I'm going to misname the pathway. Not the glucose pentose shunt, but it's the glucose to pyruvate pathway. So that's really important because, we metabolize glucose, we get to pyruvate, but there's another step here. And the next step is you need pantothenic acid, B5, which is also highly deficient or inefficient to make that acetyl group, okay? Or maybe it's thiamine there. But then you need to connect the CoA to the acetyl group, so we have the active molecule. And we have another nutrient involved there. I think that's the pantothenic acid right there. It's either B1 or B5 or both. But the interesting thing...
You're basically just describing the oxidative phosphorylation pathway in the mitochondria.
That basically, yeah, you've got that entrance into the Krebs cycle. So the question that comes up in my head is, what happens if you're on, body's smart, what happens if you're on a super low carbohydrate diet? You're not going to get the functionality of that really powerful pathway, but you recycle the acetyl group from the Krebs cycle through beta oxidation, so fat metabolism, also through ketones. You can recycle through ketones, right? And then also through a couple of amino acids, leucine and lysine as well. So body always has this innate intelligence, but what you're hearing is, but you need nutrient sufficiency to facilitate the production of acetyl CoA, and then you kind of nip off the acetyl group or acetyl group, right, to stick it on to choline. But there's a lot of rate limiting steps there, and that's what we can see. So,
and it seems like there's actually sort of a vicious cycle, because as you lose the ability to do the isolation of the acetyl group, or you don't have enough choline, and you're losing your ability to properly methylate various different substrates, you end up with an epigenetic problem. You end up with a serotonin and melatonin problem. That leads to a mitochondrial dysfunction. Mitochondrial dysfunction leads to reactive oxygen species and free radicals, which further damage the ability of the epigenetic controls to be regulated, and histone modification. So, because it's all related to those methylation steps, you're absolutely right. It really is a critical thing that your body does, is control methyl groups.
And that's why I said it's like the heartbeat of your biochemistry that none of us learned in university or high school. I mean, I still don't know if we're teaching methylation in biochemistry, like in my field. I hope so. But it's been so demonized, right? Or traumatized. But and there's a B12 piece there too. So there's even more genes to this story that we haven't talked about. So
yeah, absolutely. Let's move over to the nitric oxide side as well, because we know that there are nitric oxide synthase enzymes, eNOS, nNOS, iNOS, all three of them. And let's talk a little bit about the vasodilation or the dilation effect of smooth muscle, and how this affects, if we don't have that dilation capacity, then food can't physically move through the gut unidirectionally, or the blood vessels can't expand effectively, or there may be a predetermined link to an inflammatory condition, things like migraines, right? So let's talk about the nitric oxide side of things, the genetics of that.
This is where it gets complicated. It's also, for those of us who are geeky, we love it. We're like in the little jigsaw puzzle, moving things around. So you, in your presentation, Dr. Habib, talked about exogenous and endogenous production. And it turns out the endogenous, so the body does itself because that's innate intelligence, is a far more powerful pathway or production cycle that we want to focus in on. And I think it makes sense because when you look at exogenous, i.e. from the diet, the body, the diet can supply these nitrates, right? But they have to be converted. They have to be digested. So our saliva has to be optimal. And so does our stomach acid. I don't know about the two of you, but stomach acid and saliva is a big issue. It kind of
for a lot of people,
business.
it is.
Because
exactly. This is the microbiome, right? The microbiome is enabling the conversion of nitrate to nitric oxide to occur.
Yes.
Sorry, JP, go ahead.
The vagus nerve. I mean, the vagus nerve is
the two together, no question.
Regulating and controlling and monitoring pH in the stomach.
Exactly.
Is your vagus nerve.
And, so it's kind of like all bets are off. And with exogenous also, because when you're looking at the foods, they're the best sources. Most of them are vegetables, but they're all vegetables, right? I mean, we can pick out specific vegetables, but they are. And what are we inefficient in? Eating vegetables along with egg yolk. So then we turn to the body, and it's pretty complicated cycle. But here we come back to the methylation piece again. So let's put this together. How do we produce nitric oxide? We need an equation, right? We need arginine, right? And we need a molecule called BH4, how do we say that? Tetrabiopterin, I think. So we just call it BH4. Okay. So, and then we need an enzyme. So eNOS. Well, I think of eNOS or NOS. We'll talk about eNOS. So it's pretty often that I see eNOS as an inefficient gene, which is interesting. And when that gene is inefficient, what can happen is we have inefficient production of nitric oxide. We're going to kind of go back to the equation. And when we have inefficient production of nitric oxide, we have a very oxidative environment. We can produce very high levels of oxidative pro-oxidants in the form of peroxynitrites, which are very, very destructive to tissue. But we can kind of streamline all this. We can go backwards and say, what's the equation? We need arginine, foods rich in arginine, nutsy vegetables, right? Beans. Just eat a wide variety of foods and don't hone in on the specific foods, and we'll get arginine. There's been some interesting research that when you actually supplement with arginine, you actually tilt the biochemistry into a pro-oxidative state. Yeah, and I'm going to see if I can find that literature. I was looking at it yesterday. There was, I don't know if it was a study in Australia or where UK or the USA, where it actually was supplementing heart patients with arginine, had to stop the study. I don't know if it was producing myocardial infarctions, but it basically was not producing a homeostasis. Let's put it that way. So let me see if I can find those notes. So
there wasn't an eNOS link there.
There was an eNOS link. It was driving it to peroxynitrite. So a pro-oxidate, very high levels of oxidative stress. So where do we get this BH4 molecule from? BH4 is so critical to the body that you can't produce serotonin or dopamine without it. It's that important. So where do we get it from? We get it from actually a gene that operates in the folate cycle. So, and that gene is called dihydrofolate reductase, DHFR. What that gene is doing is taking folate and also synthetic folate, which is a danger in this case, and it's actually converting it into tetrahydrofolate, which then goes into the folate cycle to produce that methylfolate. So it's like this really important juncture. If dihydrofolate reductase is tied up in the folate cycle, particularly with fortified foods, it gets really tied up with that synthetic folate and slows down that process, which means it's not available to recycle that BH4 molecule. And that's a really important part. So here we have a connection from folate, which is why we want to eat whole foods, so that that gene doesn't get tied up. It's available to take BH2, an unstable form of the molecule we're after, and we want to recycle to BH4. If we have high levels of BH2, we have, in conjunction with a poorly functioning nitric oxide synthase genes, guess what we produce? Reactive oxygen species. So we go all the way back to the folate cycle that says, don't put junk in your mouth. Don't put fortified foods in your mouth, because you're going to mess up a cycle that helps us to produce nitric oxide, which is critical for this seesaw motion, with like you were talking about, with peristalsis, working with the vagus nerve, working with sphincters. Can you see how a fortified food diet can mess with the vagus nerve, with the gut, with muscle control? It was so obvious when you talked about that. I'm like, we have to talk about genetics. So that BH4 molecule is really, really important in this equation. But the body's like, well, okay, so we've wrecked the diet with synthetic folate, or folic acid, we call it. The body can also...
Although those are different. Folic acid and folate are different. And
when
the doctors tell you, oh, you got to take folic acid, that's not really right. That's not what you should do.
I've pushed this in the research community. There's definitely sides on this argument. What we do know is very high levels of folic acid can have an epigenetic impact. There's some very brilliant research to look at. You can't even connect cancer with brilliant, right? But it can have an epigenetic impact. And also, of course, it's when we're only looking at folic acid, or quote, folate in serum, that is not the same as folate in tissue. So we have a bunch of people working around with their CBCs, and MCH and MCVs are really fine. And we're like, no, they're not, which is why we look for homocysteine is such a critical marker when we're looking at methylation, folate, B12 sufficiency. So anyway, we've got this issue. Can you see how there's this connection between the folate cycle of folic acid, folate, and hypertension? Because these two cycles merge, or folic acid and depression, because you're interfering with the recycling of these critical neurotransmitters as well.
You're not making them.
You're not making them. And then you have vitamin B, B12 inefficiency, or there's iron deficiency, or vitamin D deficiency. They're all involved.
Burnout.
We pour into these funnels.
You get a dopamine problem. I mean, it's enough of the dopamine rush that we're all getting from social media and Netflix and the rest of the things in our lives, but we're not even making it properly.
We're not making it. Yeah. And there's huge connections there, again, back to the vagus nerve. So, this is complex biochemistry we're describing. And those of us who are geeks, you can always tell a biochemist because we do this. we conduct in cycles, right?
I have a question, because when I sort of grew up in this space, I grew up in it looking at migraine. And nitric acid, anytime anybody says nitric oxide, I always go to, NO donors will cause migraines. And NO donor, and I know that, red light therapy is all about dislodging nitric oxide from cytochrome C oxidase, which is critical in your mitochondria. The reason why red light therapy is so beneficial is because it's dislodging the nitric oxide that binds to and basically clogs up your cytochrome C oxidase, which is critical for oxidative phosphorylation and electron transport. So yes, it's important to make nitric oxide. It's really important for blood vessel dilation, and we're talking about the gut, but there's the downside.
Exactly.
You have to balance it.
It's the balancing act that needs to be made. Exactly.
But you can imagine. Go ahead.
Remember that with migraine specifically, and obviously that was a subset population you were working with, they're generally very high on the iNOS activation. And iNOS is almost specific to macrophages, right? It's an immune activating nitric oxide boosting tool, but the level at which nitric oxide is produced with iNOS is different than eNOS and nNOS. And
Exactly.
those
Yes.
two, eNOS, which is endothelial, and nNOS, which is neuronal, are both regulatory. They're oxygen dependent, and they are very kind of low to moderate producers of nitric oxide in a regulatory fashion, which is where that balance piece comes in. You want to get to that optimal on the bell curve of being in this space, because that's where good things happen. When we're too low on nitric oxide, motility issues, right? We have blood pressure issues, peristalsis, all of those challenges. But when we get to the really high side, which is where the iNOS activation occurs, that enables the inflammatory activity. And the way that it does so is enabling phagocytosis, really literally allowing the stretching of a cell to engulf toxins, PAMPs, DAMPs, whatever, right? To engulf and to absorb that issue. And it requires a ton of nitric oxide to make that happen, which is why it produces nitric oxide in such high quantities. And so these NO donors that in a situation where there is an inflammatory burden already, where the macrophages are already set to a more threat response mode or cell danger response mode, those immune cells are far more readily pushed into that inflammatory iNOS level of production. And so that's where we get the symptomatic nature. So we have to hit that balancing point with eNOS and nNOS levels of NO production. And so that's where nitric oxide testing is actually really beneficial. We're not testing nitric oxide levels, we're testing nitrite levels. And that's through the oral saliva, I have them sitting here, the test strips that many companies have. Now Berkeley Life has it. I believe they're the ones that created it. And that test strip is helpful in knowing how much raw nitrite do you have. And if you don't have this situation of incredible hypertension, significantly high levels of inflammatory activity or migraines, and you show up low, then nitrate supplementation can be beneficial, but it has to be on a daily basis because it's not a long-lasting tool and powerful like eNOS and nNOS are.
But and this may be just a silly tangent, but the way your brain learns and the way your brain takes in information is microglial cells, which are your macrophages of the brain. They do phagocytosis just the same way they do it in the rest of the body when you get sick. But they're using that technique or that process to shape and sculpt and prune the network. We've talked about it's trogocytosis versus phagocytosis. But that's why when somebody's giving you a tremendous amount of information like this podcast, people say, "Oh, you're making my head hurt," because they're getting all that. No, I'm just kidding, obviously. But yes, there is a link there, which is you have that much energy and that much going on. There is nitric oxide involved. Nitric oxide does lead to vasodilation. Vasodilation is associated with migraines. And so, yes, you're giving me so much information, I'm getting a headache.
But the body's brilliant, right? So, and thank you for taking you on this tangent, because there is an iNOS side, which is where the vagus nerve comes in, as an anti-inflammatory. So we need the acetylcholine to act as right. So we have to come back to that.
That's the yin and the yang.
We got to have one more piece to the geek thing here, because we got all off on the nitric oxide. I'm they're going to bring up the migraine piece, which is true. But you could kind of see there's some inefficiency from the folate cycle. So you can end up with this yin and yang, oh my God, one day there's a fire hose, the next day there's nothing. But the body has another endogenous pathway. And this is what's brilliant. If you activate the transcription factor NRF2, which will fire a bunch of antioxidants, right, which will help with mitigate that pro-oxidative environment. But that when we activate NRF2, it activates another cycle to help you produce BH4. So if we activate NRF2, we get systemic relief, right? And it comes back to eat your cruciferous vegetables, people. And yes, some people need some sulforaphane support because genetically they're just inefficient. But if you kind of tap that pathway, I think we would have a smoother nitric oxide production cycle that's not so elastic.
So is this would this be something you would suggest to people who have migraines, that perhaps there's a dysregulation in that cycle?
Yes, 100%. 100%. Yeah. Yes. But like you said, the migraines, and I've lived with a man who had migraines for 30 years, and we finally kind of got almost through to that aperture, that root cause, which is difficult. But what is very clear is it's an inflammatory process to me, and finding where the inflammation is. But sulforaphane has been really key in mitigating inflammation. So
sulforaphane is also a very important nutrient when it comes to estrogen balance and hormonal balance. I think is an important piece for a lot of people. Cruciferous vegetables have sulforaphane and DIM as very important nutrients that are here, and they are necessary in the regulation and the elimination of excess estrogen
yes.
levels. And so we come back to, and I feel like this is going to keep happening with genetics and genomics specifically. It's all of these interactions that enable optimal function to occur. And we're going to come back to kind of an overarching theme of all of this at some point. But I just wanted to talk about that because you mentioned estrogen is very important earlier on in acetylcholine and nitric oxide production. Now as well, the same tools that regulate and produce NRF2 are also regulatory in the estrogen 100%.
Pathway. They are. Yeah. In fact, I'm trying to think of what we're going to get off course here. That's another conversation with estrogen detoxification, but you cannot detoxify sex hormones without methyl groups. And NRF2, which responds to sulforaphane, activates stage 2 detoxification genes. So MNSOD, GSTM1, and COMT requires that methyl group, and on and on and on. So NQO1, critical target gene in estrogen detoxification. So when you were told, eat your cruciferous vegetables, nature put them there deliberately. They just did. There is power in those vegetables, which is why when you look around the world at countries that have a lot of herbs and spices, particularly herbs, but also cruciferous vegetables like Chinese cuisine, for example, things like bok choy and all the different cabbages, et cetera, and things that come from the hills and the mountains are replete in glucosinolates, which are integral to sulforaphane production. So
I want to make sure that people know when you talk about foods of Chinese origin, Chinese food, we're not talking about noodles and the rice and all of the process.
No, I'm talking about the vegetables.
What is generally known in North America as Chinese food.
Yeah, sorry,
it's the real whole foods present in those Asian
and you have
areas.
to worry about where they were grown, because if they're grown in the mountains, as you say, they're going to be filled with the right nutrients and the right trace minerals, et cetera. But if they're grown in an industrial, on an industrial farm in Southern California where the soil is nowhere near as filled with minerals anymore, you're not going to get exactly what you were banking on.
I feel like we've really gone down the genetic pathway, and I think we've thrown a lot of stuff on people from the genetics genomics side of things. Let's take a little shift to the nutri side, to the nutritional support. So let's talk a bit about how you validate these things in terms of the testing that you're using to identify genetic variants or genomic balance issues. Epigenetics and genetics. What tests do you like to use in clinical practice?
Yeah, and it depends on world area, and it also depends on what I'm looking at too. So for the majority of the cases, because I'm working here in North America and in Europe, the majority of cases I'm using 3x4 genetics. It's a polygenic test. So we're not just looking at one gene, we're looking at lots of genes and pathways. So it can inform us of where the weight is, where the priority is in the body. I also used DNA Life in Europe. They have a number of different tests. And if I'm looking at what we call them nervous systems, so neuro, as I would call it, particularly when I'm looking at kids, like behavioral issues, ADHD, what have you, I'm going to look at Life Code out of the UK. So I will put together a test based on what I'm looking for. But 3x4 would be the one I use the most. It's not available globally, so that's why I may switch, to different companies. But the bottom line is the companies I'm using in general are direct to practitioner, not direct to consumer. Even if they are, they're almost impossible for an individual to interpret. And I think that's just such an important point. This is incredible science, but genomics is not what I call line item nutrition. I got this gene, take this. I got this gene, take this. It's not an accounting ledger. It's a reflection of very complex pathways. So those are the tests I use. But to the point about integrity in science, I'll judge a test based on when I validate what I'm thinking in the labs. They come back at about 95% validation of the inefficiency in those genes.
That's really good to know. And I think all the clinicians out there, just be aware when you're utilizing this that you want validation piece to be necessarily high. You want good data so that you can literally help create the change that your patients are seeking when they're in with you. And patients, hold your doctor to a high standard. Make sure that they're using the right tests to help identify these things. There are a lot of tests out there, right? Just doing a basic 23andMe and expecting to have a wonderful result off of that is not likely to happen. I think that's an important caveat. Anything to add on that, Amanda?
What I would say, and what I've learned, because I was an early adopter in the field, is the client story is the most important story. Your story, your symptoms, what your questions are, what you are looking for is actually what guides me. That is my intake form. So what is going on? What can I help navigate for you when I'm looking at your genes? So a test, so even with a 3x4, these are really, really good tests. Even though they're providing me with the genes, I kind of pull back the cover and I actually rebuild. I don't rebuild the test. I rebuild the story based on how I'm looking at genes in different pathways, which is a talent. We teach clinicians, pattern recognition, so that if you were to read a test that, you have issues with oxidative stress and a blood pressure. Well, actually that's true, but the real issue is methylation and detoxification. So understanding the client story is what actually helps me figure out what to look and how to prioritize what the patient story is. Then we validate it. So if you're seeing someone who's reading a test and saying, here, this is what's going on with you, here's a bunch of supplements, or here's your diet, here's your exercise prescription, without the clinical validation from lab data, I think is misleading.
And without taking the time to understand how the results from this test interact with the results from this test.
Exactly.
You go to a doctor and they look at your cholesterol level and they say, you need a statin. There's no investigation.
Right. You have to investigate.
First off, that knee-jerk response is wrong off the bat anyway. But when you get into it takes the time to decode every individual. We've got 20,000 genes. We've got that, and that's just the human genes. That doesn't involve the 2 million genes that we've learned now from, what was it, Krishnan?
Yeah, Karen Krishnan. That's right. Yes.
There's 2 million genes in your microbiome that you have to take into consideration because those proteins are interacting and having an effect. So yeah, it's just impossible to just think it's a formulaic thing.
It's not linear.
Yeah, you have to decode the puzzle.
Yeah, it's part of the, and I think it's important to say that genomics is one tool in the toolbox. It's very powerful in that when I lay it out, it's like looking at how you're built, but that's just the infrastructure, right? And it can guide our thinking, but it doesn't replace other tools. It helps guide us to which tools are useful, how to validate, but in no way do you take a genomic test and say, well, this is wrong. So what's wrong with me? It's not predictive and it's not diagnostic. It's informative on the clinical side to help guide therapy. I think that's important.
I think a nice little analogy for this is like looking at a map is not the same as driving on the road. The map, it gives you the directions, it gives you the expectation of what direction you want to go to get from point A to point B, but it doesn't tell you the quality of the road. It doesn't tell you if there's construction that's occurring. It doesn't tell you about the little unique things that might be happening in real life. And that's where the history taking, the clinical background, the clinician's view of how things should be working together need to be taken into account. So it's not just like a map on a piece of paper. We literally are looking at the terrain and driving that terrain with somebody and what's their experience in terms of what they're trying to accomplish at the end of their
I think this is a great analogy because this is why we're shifting over to using functions like our Waze or Google Maps or whatever we use in the car to get from one place to another. Now, setting aside the fact that we're all losing major abilities to find our way around without them, but there is this need, I think, that is growing as we learn all of the different things that impact our health. Genetics, epigenetics, nutrigenomics, all of the different pieces, all the different chemical pathways that need to be taken into consideration and the redundancies in the system, it really is going to become something that human beings can't decode with the same level of efficiency that an artificial intelligence will be
No,
able to do.
100%. 100%.
And I think we need, and this is a call out to those people who are, specialists in AI. What we need to do is merge the knowledge base that somebody like you has, and that we try to help, get out there with an AI system that can look at a panel of different tests and then ask for the right test to validate what their assumptions are.
Believe me, I've been looking at it.
Yeah, no, and that's the next step is going to be. And I think within 5 to 10 years, you're going to be able to, do a little thumb test and, with a little bit of blood, a little drop of blood, and the AI is going to be able to decode all of these things. And it's going to give you a very personalized approach to what your optimal health strategy should be.
I love this. I think you're like Elizabeth Holmes from Theranos was a few decades early in terms of what she wanted.
Was a few sandwiches short of a picnic.
She also was. There was a whole nother side to this, but I just thought the
I'm not sure I like
blood.
the analogy of that. Let's just say I'm trying to be like Elon, looking and saying I'm gonna pick a rose on Mars. So
absolutely,
we'll see.
Amanda, let's get into the nutrition. We've talked about sulforaphane, DMT, or not DMT, my goodness. We've talked about sulforaphane. We've talked about DIM slightly. We've talked about the use of cruciferous vegetables, things like bok choy, to get those in. You've mentioned choline, egg yolks, some of the foods that we can get the choline in. And then we talked a little bit about whole foods versus processed foods and the inflammatory effects that they can have. It may sound a little generic, but let's talk about some of the more basic nutritional tools that everybody should be following, and then where there may be some nuance when it comes to certain genetic or genomic findings on testing.
Yeah, in the end, when I stand back from this work, we pretty much all need to eat the same way. We just do. If I only had say $100 to spend on food at the grocery store, what goes in that basket to meet my needs? First of all, you start with the cruciferous vegetables because they're such a heavy lift from a nutrient and polyphenol perspective. And that's normally the section a lot of people creep by, So, and it's not just broccoli and kale. Let's expand it. It's arugula or rocket if you're outside of the U.S. It's things like bok choy, radishes. All the radishes are a great source of the glucosinolates to help produce sulforaphane. So cruciferous vegetables do not inherently contain sulforaphane. We make them, which is a culinary kind of insight for another day. But next to that, as you keep hearing us talk about methylation, the next most important group of food are foods that are naturally rich in folate, because that your body cannot work without folate and it can't work without B12. So we need to talk about that too. So folate, foods that are rich in folate are often rich in all the B vitamins too. You cannot produce energy without B vitamins, period. B2, B6, B1, B3, all of these are critical nutrients. So folate, we often think of foliage, or foliage, so green things, but the best source of folate are actually legumes or beans or pulses, depending on which world area you're in. So we always think of meat, greens, and beans to get folate. Not everyone likes to eat food with a face. So then you must have beans. That they are kind of nature's backup or your source if you are vegetarian or vegan. So remember, pulses or lentils and chickpeas and mung beans, they will make your folate boat float. So they are essential in any which way. So you've seen two huge categories of food there. And then, the third would be, where are you going to get your B12 from? And where are you going to get your omegas from? And that's where we can go to do battle in the food world. It's where ethics come in, and we're not going to get into that here. But, that I come from Europe, and when you live and work in the Mediterranean, we always think we have these rose glasses on. We look through these rose-colored glasses like, oh my gosh, everyone in the Mediterranean eats salmon every day, or they eat seafood every day. And they don't. They just don't, because most of the Mediterranean is very, very rocky and mountainous. And you can see the ocean in these tiny villages, but you can't get to it because many people in the Mediterranean are poor people. They don't live on the Amalfi Coast or the Cinque Terre, wherever. My parents lived in Spain until very, very recently, like right on the coast. And yes, the seafood market's right there. But if they were going to the mountains, they would be eating quail. They would be eating deer. They would be eating hare or rabbit. They eat a lot of snails across the Mediterranean for omega-3. So it's a really important part that we have the acronym, which is critical for our omegas, which is like SMASH, and they're all fish. But a lot of people don't like seafood. Some people are allergic to it. And we're forgetting that we can get these critical molecules, EPA and DHA, which are our omegas, which we can't function without neurologically or from an immune perspective, that we can get those in a wide variety of foods, and it's not necessarily seafood. You can get it from seaweed, right? So, but that also, the omega conversation also gets into the B12 conversation. Right? B12 inherently in a form the body identifies it is in foods with faces. That's a Michael Pollan thing, right? If it has a face, I mean, it just is. And there are synthetic forms. We can get beautiful infused olive oils with krill oil or seaweed, which produce, it's not, I think it depends on the individual as to whether they can utilize that form of B12. I mean, there's more and more science now that really suggests that we can utilize that. But the best form of B12 is going to be in nature's, what nature put on this earth. So I'm dancing around that one. But B12, the reason I'm mentioning this, it is so critical to methylation as well. So this methylation process where we can't produce acetylcholine without it, or choline, B12 is also highly deficient. And I think that comes from dysbiosis, poor digestive tract, dysbiosis, but also poorly informed dietary intake as well.
Are there any nuances when it comes to specific genetic findings or genetic variables? You mentioned methylation. We'll often hear about the MTHFR gene, and where people who are supplementing maybe want to avoid the methyl forms of B12. They want to focus more on the adenosyl or hydroxy versions.
Hydroxycobalamin, yeah.
Yeah. Are there any other specific ways to get around it if people have a genetic variation that actually stops them from being able to absorb or utilize specific nutrients?
Well, I mean, it's a big story. And a lot of times I think it's B12 inefficiency or inefficiency as directed by their genes. So what I would say to that is a lot of people say, I've got MTHFR, therefore I need a B vitamin complex. And that is like taking drugs for the body, because anytime we supplement, the body needs micro amounts. That's the one thing I'll say. You want to take supplements that are physiologically and compatible, because if you don't understand your genetic makeup and the inefficiency is with folate and not B12, and you're taking a B complex, now you've amped up a methylation machine, which neurologically will put somebody into a mental health day. So, B12, there are a lot of things genetically can impact it. The FOOT2 gene, TCN2. There's also genes that affect its utilization. So that's MTR and MTRR. So a lot of times I'm not measuring B12. I'm looking at homocysteine to see where the inefficiency is. And I'm going to correct it through food first. And I'm going to very subtly massage any B vitamin supplementation. It's like kid gloves, because the impact of overmethylation is severe. If you've ever seen that, it just is. You can drive so many processes off the road that I think we've created a lot of hysteria around one gene. Even among clinicians, I've done it. Please, anyone, if you're a clinician or you're just listening, there is no such thing as testing for one gene. It just is wrong. It's ethically wrong. The methylation cycle requires a whole host of genes to help us understand where the inefficiencies are and how that collects to the methionine cycle as well. So you want a panel, you want a polygenic test. You do not want to test for one gene, because I think it's almost malpractice, because you're making judgment on one stop sign.
Exactly. Where all of these genes interact and work together to create a functioning human, right? And I think that cannot be understated or overstate it at all. Like this is an important thing to understand. I remember when I first learned this, I was learning from Kashif Khan and Muhammad, oh my God, I forget his last name. But functional genomics, the idea of the fact that all of these genes, individual genes, work in a collective together to create and build humans, literally, to build every single thing that functions on this planet. It requires a multimodal approach. It cannot be sitting there with like a laser pointer saying this is the issue. It's never one thing. It needs to be done in a holistic fashion. And that's where holistic functional style medicine is really helping to create that awareness. We can't hone in on one organ as we have in conventional medicine, the same way we can't then, if we go into holistic and nutritional genomics and genetics, just hone in on a single gene. We need to remember and think broadly. I think that's a big pointer here. JP, any final questions there for you?
No, I just want to just bring it back around to the vagus nerve for a moment. We talked about acetylcholine, we talked about nitric oxide, we talked about the gut and the importance of everything from pH to motility. The vagus nerve is intimately involved in these things. What we haven't talked about is, and we started at the very beginning, and I even pointed out, is like I really like the way you said it. It's not just nutrition that we take in. Our nutrition isn't only food. Our nutrition is everything that we put in our body and everything we experience. And so when we take in bad energy, and I'm not saying bad energy in a new age kind of way, I'm saying it from the standpoint of like when we allow ourselves to get frustrated or angry or out of sorts about something, or we experience something in a negatively stressful way, as opposed to reframing it as an opportunity, a challenge. I mean, I love that. I love that meme that says, when in your life did you learn something? When in your life did you grow? Because it was easy. Okay. You don't grow because it's easy. You grow because you did something difficult. And you have to understand that your autonomic nervous system is your front line, defense and offense, interacting with everything that you have that's coming into your body that isn't food. And even as a food, it's right there. What's your advice to people about regulating their autonomic nervous system as part of this healthful process that you're talking about?
And you're right. We didn't even talk about this, and we should come back and talk about that because this whole other pathways and genes are involved if you don't regulate your autonomic nervous system. What I have learned now in my practice is that failure to do that, it doesn't matter. Let me restate this. It doesn't matter what I do with food and nutrition. If I don't regulate the inputs, I can't fix you with food and nutrition. I can't. In other words, if we don't take care of the inputs, if you don't take your foot off the gas pedal, the destruction that's done from that. And I'm just thinking through all the pathways and the genes right here and like elevated levels of norepinephrine and this constant stress response, we can't get you to resolution. And I'm thinking about patients right now, and I was, Dr. Beebe, you and I talked about this, with using Truvega, the device, but also using other modalities like Qigong to reset the nervous system. I'm thinking of patients right now, that's all I can have them do. I'm like, I can't fix your gut right now until you tap into your innate energy and give your body its vitality, which helps reset, the nervous system, helps you stand down so we can do the work. So it's critical. And I think that's what Chinese medicine is about. If you don't do this work to stand down, there's no nutrient, there's no diet, there's no modality of exercise. Well, there is exercise until you do that hard work. And I think it's the hardest work that humans have to do because you got to be still and you got to listen to you. And we're not tuned to do that in North America very well.
No, you're absolutely right. We talk about this a lot. And this, you're right. You should come back and we'll talk about this further. I have a paper coming out with a group that I've been working with on what I refer to as the autonomic deregulation theory of aging, which is that all of the different pathways that you're talking about and all the pathways that have been written about aging, about the common biochemical and physiological processes that take place in aging, every single one of them, you can point at the geekiest level you want at the chemistry and the physiology, every single one of them gets worse or accelerates when you are in chronic sympathetic activation. And every one of them slows down and gets better when you enter into periodic and frequent parasympathetic recovery mode. You have to do that. Everything else is not, all the other therapies, think about how fundamental we're talking about diet, exercise, and sleep. None of those things will work. None of those things can work if you don't get your autonomic nervous system regulated into periodic, short bursts of sympathetic activity that's positive, and then parasympathetic recovery. You have to balance.
It is so clear from it's funny, you mentioned it. The paper I was reading yesterday, Hallmarks of Aging and Expanding Universe, one of the hardest papers to read if you got read. I'm like, wait, I
know Lopez. Lopez and his whole team, Lopez Oten and his whole team. Yeah.
Yeah. But, and I'm like, this is really advanced science. But as you were talking, it's like, none of it matters. You can't lose weight. And so I tell women, you cannot lose weight until you stand down so that your vagus nerve can do its job to regulate the immune system. When that's activated, which is going to be constant, can't lose weight. Mm-hmm. So, and that's a whole other discussion, but it is about, maybe the first thing we should be learning in school is the nervous system, the autonomic nervous system, how it works and how it infiltrates you at a cellular level, immune level. It infiltrates and impacts every single system in the body.
But they do learn it outside the United States. They learn it in countries like in India. They learn that. They learn it as in Japan. You don't even get grades for the first 3 years you're in school.
That's what I learned.
All they're teaching you how to do at that level is how to be a good person, interact with other people well, and how to regulate yourself. That's the most important thing to do.
And I learned that recently, and it's just like all the alarm bells, not the alarm bells, it's just like all the synergy went off with the biochemistry. And yeah, I mean, that's what yoga's about, right? It's, and all these modalities, Tai Chi, and it's just amazing work. So yeah, and in trying to find a way in clinical practice to help individuals understand that, it's a hard conversation. And maybe that should be my intake form. Listen, this is where we're going to work. Self-awareness. When you've done this, come and see me. I can help you,
Yes. Yeah, the pre-work that needs to be done by every single patient that potentially is coming through the door is no question. I love to kind of lay it out in this way. You cannot heal in sympathetic state. You cannot grow in parasympathetic state. You need to be able to go back and forth between these two. You need to be able to regulate that resilience piece. Autonomic regulation is the key to all of this. And I think overarching thought about this entire conversation is there are nutritional tools, there are genetic pathways that are necessary. There's all of these pieces to the puzzle, but it all comes down to your ability to regulate your state. Autonomic deregulation, autonomic regulation, sympathetic, parasympathetic. It's so important for everybody to truly understand that that is what's driving the specific pathways of healing or of growth. And if you're not in the right state, you're never going to be able to accomplish that goal. So I think that's huge for everybody. Any final thoughts, Amanda? Where can people learn more about you and your work that you do?
Yeah, I'm at the Genomic Kitchen, and genomickitchen.com. Or just find my name, and it'll lead you there, and you can see what I'm doing. Whether you're a clinician, I'm training in the space. Whether you're a member of the public, lots of different ways to learn in the U.S. and more around the world too. So.
Amazing. Well, thank you so much for joining us today, Amanda. And for everybody who got to this point in the podcast, please share this episode with one person who you think could utilize this information to upgrade their health and take it to the next level. Thank you again, Amanda. We'll have you back to talk about the autonomic deregulation, emotional side of things and the genes that are involved there. And we'll catch the rest of you on the next one. Bye.
Thank you.